I thank the member for Lingiari. The question is that the bill be agreed to. I give the call to the member for Cunningham.
Thank you very much, Acting Speaker. And look, I want to take the opportunity, as brief as it is. I think there's something particularly sad about the fact that this debate has been gagged by the Minister for Communications, but probably the hypocrisy is fairly consistent with the government's approach to most policy areas. It is a bill that obviously I'm taking the opportunity to make it clear that I oppose and to put some record on the House in the short time available to each of us about why I have that view. And like my colleague, the member for Lingiari, I want to talk about a group that's particularly vulnerable in our communities, in all our communities, and a group that don't often have a very good rate of accessing health services, and that's young people. Now, for a lot of young people, generally I'm talking here post-school age young people who are struggling in insecure, unreliable jobs. They may have irregular income. They might have a little bit of income support, obviously, at the lower level, as is the case with younger people. It can be even worse under this government, under 30. Yes. All of us with kids in their 20s are pretty horrified at this thought the government has that anybody under 30 has got to be out living at home forever and a day. And I would have thought that most of them would have been encouraging young people to get out and be independent and not to be up to the age of 30 looking for some support from home. Sadly, for many young people, there's not a home to look for that support to. And like many of my colleagues, and I know the member for Throsby, we often together visit some of the homeless services for young people in our area and talk to these young people. A lot of them are also young parents. What's the reality of the cumulative effect of health initiatives in this government's budget that they now face? Let's put that all together. So a young mum living at one of those services with a toddler. She's homeless, very limited income, probably trying to get some education to improve her chances in life, and they get sick, the flu hits. Off to the doctors, and it's $7 for both consultations, for her and the child. There's $14 to start with, under the brilliantly conceived GP tax that's about to dismantle the universality of our healthcare system. And the doctor says, look, I just want you to go and have a quick blood test each. I just want to do some diagnostics. So off they go to the local pathology service, and another $7 each. $14 extra there, so up to $28 already. Now, unsurprisingly, you're not allowed to read your own pathology test. You have to go back to the GP for another appointment for the both of you, another $14. So now we're up to $42, and we haven't even got to the point of filling the script. This is the cumulative effect of the impost that this budget is putting on people who can least afford it in the health sphere. And so, for that family, another $5 to $6.90 on the cost of the prescription. Buy 2 prescriptions, at minimum another $10. You're talking another $50 more for one period of illness for that mum and her kid on what they would previously have had to pay. The reality of the outcome of that situation is that people will make the decision not to go to the doctor. If they go to the doctor and the doctor gives them a reference to a pathologist or any other sort of diagnostic services, they'll walk out going, yes, doctor, I'll go to that, and they don't follow up and get it done. If they do follow up and get it done, they might then be looking at, will I go back to the doctor, can I really afford to do that? And then even if they go back to the doctor just for some peace of mind about what the outcome of the tests were, it's increasingly likely they then won't get a script filled. And so every barrier you put for people in the chain of decision-making about accessing health services increases the likelihood, particularly for the most vulnerable, that they will drop out of that chain and not actually access those services. And that's the reality we face. And I would have thought everyone in this place would understand that an ounce of prevention is much better than the cost of the cure. We all know that if you get preventative and primary health care right, and you get people engaged and participating, you actually save money for the budget bottom line in the long run. So it's not only bad health policy, it's bad fiscal policy as well. In fact, it's not a surprise that many people, including only last week I got a letter from a radiology group in my own electorate, expressing their grave concerns about the impacts of exactly the sort of scenario I've outlined. So this bill should be opposed. It's bad policy and it's a bad fiscal decision as well.
I thank the member for Cunningham.